Good afternoon. It's almost good evening to all of you. And I'm the last speaker, so I'm separating you from your dinner, maybe. No, but first let me thank the organizers for this very important meeting. And a special thanks to you, Dr. Ward, and also to Professor Hassani for your continuous leadership on this fight. And thanks also to all the countries who are fighting the good fight, because you are keeping this coalition alive, and this is so important right now. Brazil is very proud to be part of this coalition. And then I'm gonna separate my 5 minutes in two parts. One is more of a political declaration, because, we cannot, as a Brazilian, I cannot understand some of the things that are happening. And unfortunately, the Brazilian Minister of Health, Dr. Padilha, is unable to come to the UN General Assembly because he received a very restricted visa that he could only circulate 5 blocks from the UN. So he decided not to come. And this doesn't only affect the General Assembly, Brazil's participation in the General Assembly, but it also affects because he cannot go to the PAHO meeting, the ministerial meeting that happens next week in Washington. And let's say it's not we are seeing, when I'm saying a political thing, it's not a mere measure of retaliation against the minister, because this is an attack, what Brazil represents in the fight of denialism. I think we're seeing this, right? And it is manifesting in different forms, and in a way we're being silent about it. It strips children of their right to safe vaccination. It endangers access to life-saving drugs, like for HIV in Africa. The colleague, I haven't met you yet. Pleasure to see you here. And it also compounds the setbacks in health that the population in this country is facing right now, right? And we should have learned with the COVID pandemic that no one is safe unless everybody is safe. In this, we're seeing right now a resurgence of measles in Latin America because North American countries cannot control it. Anyway, now let me talk about hepatitis. The Brazilian response to viral hepatitis, that Brazil is recognized worldwide as a reference in public health, and also we are strong advocates for equitable access, vaccines and science and life. And we also have taken the leadership role as expressed by the BRICS Minister of Health declaration on health. We take it very seriously, including President Lula, who himself presented in the declaration as the presidency of BRICS, the socially determined diseases as a joint agenda. Some of the countries here are part of the BRICS agenda. So we have taken this very seriously, right? In our national health system, which we call SUS, right? SUS is the Sistema Único de Saúde, has turned 35 years old last Friday. So this is like, well, young compared to other countries. But it covers 70% of our population, and in some states it's almost 100%. Okay? And in chronic infections like hepatitis, HIV, it's basically the main provider. And in Brazil, with the provision of appropriate care, including monitoring, disease progression, availability of antivirals, we managed to reduce since 2015, 60% mortality due to Hep C and 50% mortality due to hepatitis B. And vaccine coverage for hepatitis B is more than 90% in the first month of life. So, like in this country, and now let me make a position here. In this country, we saw many scientific advances that have helped the world. And Brazil can also showcase, this country in Brazil can also showcase the cost benefit of having public policies to vaccinate newborns, all newborns, against hepatitis B. And not only mothers who are positive. This is something that we have proven already. We don't need to discuss this anymore. We shouldn't need to discuss this anymore. And Brazil is then firmly on track to eliminate vertical transmission, mother-to-child transmission of hepatitis B by 2026, next year. This year, we are going to eliminate transmission of vertical transmission, mother-to-child transmission of HIV. So, and then Brazil, like Egypt and some of the other countries who spoke before me, has also invested in the production of medicines against hepatitis. 90% of the medicines against hepatitis B are produced nationally. Right? And for Hep C, 70% of the patients are treated with generic produced nationally. Sofosbuvir and Taclatazvir. And this is through public and private partnerships. So we still have many challenges, right? Because we still don't know exactly how many people we need to treat for Hep C and Hep B, because still modeling and so on. And we also we need to learn a little bit more about strategies for elimination in areas, vulnerable groups in difficult to reach areas. Brazil is a big country, so we have indigenous people, and some places are hard to reach. We have hard to reach populations geographically as well. So, to finalize, in spite of these recent setbacks, we remain very committed to the UN Group of Friends to Eliminate Hepatitis, in the understanding that regarding some global health problems, we need concerted actions. So let me end with a quote, and as I get older, I get more, I'm listening to Pink Floyd lately. And there's this music, Hey You, that says, it seems very appropriate now, very adequate for these times of uncertainty we are living through. Don't tell me there's no hope at all. Together we stand, divided we fall. Thank you all.
Thank you. Thank you.